Hello. So first of all, I wanted to start by acknowledging the country that I'm on in Sydney, Australia. I'd like to acknowledge the Gadigal people of the Eora Nation, the traditional custodians of this land, and pay my respects to elders past, present, and emerging. Secondly, I wanted to welcome you to the patient panel discussion for the DARE conference. This is the second patient panel. My name is Susie Breuer and I am a Refsum patient. I'll be hosting this panel, and Susan Kuranoff and Mark Liquorish is both very kindly agreed to join this panel. So before we get started, Susan, who's on the DARE board, is just going to say something very briefly about what DARE is and what our aims are.
Okay, thank you very much, Susie. So the Global DARE Foundation was established in 2019 at the end of the year. DARE stands for Defeat Adult Refsum Everywhere. Our mission is to promote worldwide awareness and better quality of life for all who are diagnosed with adult Refsum disease. Our goal is to support research, education initiatives, awareness campaigns such as this DARE Fest, and advocacy. Driving research is at the center of what we do because we do dare to believe that there is a cure for adult Refsum disease. Back to you, Susie.
All right, thanks so much, Susan. So the first question, which is probably going to have the longest response from all of us, is to describe your Refsum journey from pre-diagnosis to where you're at now. Did you want to start, Mark?
Yeah, okay. Right, good morning, or good afternoon, everyone. My name is Mark Liquorish. I live in the United Kingdom in England. I am 70 years of age and retired. My Refsum journey started many years ago, back at the age of 10, when I noticed that the stars disappeared out of the sky, which at the time didn't want to be too much, but later on began to realize that something was not quite right. At the age of 12, I had a school medical. The medical officer took great interest in my feet, spent a lot of time studying them, but in the end let me go. And after that, I actually joined the nursing profession as a nurse, and I began to realize that I couldn't see terribly well out of the sides of my eyes. Anyway, I carried on, passed my exams, and then I had a road traffic accident where I missed something coming at me from the right. By this time, I was 22 years of age. I had investigations which proved that I'd lost most of my peripheral vision, and I was diagnosed with retinitis pigmentosa. The question was, there's nothing we can do for you. Thank you very much and goodbye. By the age of 24, I began to notice that I was having difficulty in walking. And one night I was running to an emergency in the hospital and I just fell over. I picked myself up, didn't think any more about it. But then it continued to the point where I couldn't actually walk, and I ended up in a wheelchair. I used to get very breathless and sleep a lot. I was sent to a centre of excellence in Stoke, which specialised in neurological diseases. And after a series of tests, they were still inconclusive as to what was the matter with me. They had grand rounds, and one of the young SHOs ventured a diagnosis of Refsum disease to the professor of neurology. The professor of neurology told him not to be so stupid. Didn't realise how rare it was, and I certainly hadn't got Refsum disease. So he sent, unbeknown to the prof, a blood to the labs for analysis. It came back. 3 days later, the prof was back at my bed and said, "It would appear I was wrong. You have Refsum disease." And as a result of that, people hadn't seen a case of Refsum in the UK for over 10 years. So I was paraded in front of various specialists up and down the country. They started me on the Refsum diet, and within 3 months, I could actually walk again. And within 9 months, I was back at work. I've continued to live on the diet, and I continued to work until I was 60, when I decided enough was enough and I retired. I was introduced to the DARE Foundation in 2019. I became a UK ambassador, and I'm now currently a board member of the DARE Foundation. Whilst at 70, I feel I've lived with Refsum for a long time. I believe that we can cure it, and I guess my mission now is to ensure that newly diagnosed patients get the best chance that they can of living a fairly normal life. Because at 70, you think you're doing all right, and you just hope that the diet has kept you in reasonable shape. Other than that, I keep reasonably well. I do have Meniere's disease, which doesn't help when you've got cerebral ataxia. Other than that, it stays under control. And that basically is my story.
Thank you, Matt. Susan, did you want to share your story?
Sure. Thanks, Susie. So my name is Susan Kuranoff. I live in Switzerland, but I was born and raised in Canada, and I left Canada at the age of 23. I'm now 60, and I have been living with Refsum since the age of 34. I think my Refsum story is a bit atypical in that my journey to a diagnosis was relatively short, thankfully, because as we all know, Refsum is one of the conditions where the RP can potentially be slowed down through diet. So as a child, I didn't have any issues, apart from the congenital abnormalities that many of us have, the shortened toes, the shortened thumbs. And apart from that, I developed extreme knee pain at the age of 18. And when the doctors had looked at that and examined me, they said, oh, this was nothing that they could explain. I had the cartilage of a 70-year-old, but apart from that, I was healthy, and I should, just not worry about it. So thankfully, my childhood progressed really without problems, and it wasn't until the age of 32 when I started to develop issues with my peripheral vision. I was on vacation at the time, actually, vacationing in Ireland, and I started to get a glimmer on the periphery of my vision. And that led me to go to see the ophthalmologist. And at the same time, I had also lost my sense of smell. So I had gone to see the ENT specialist. And although I had told both of these specialists that I had these concomitant issues going on, neither of them really made any connection between sense of smell and the RP. So the ophthalmologist diagnosed me with retinitis pigmentosa, and the ENT specialist said that it must have been a virus that had killed my sense of smell. When I got my RP diagnosis, the consultant nurse there gave me a pamphlet about a self-help group for people with retinal diseases by the name of Retina Suisse. I made contact with them very quickly because I wanted to find out more about the disease and connect with others who had been diagnosed with retinitis pigmentosa. I became a member of Retina Suisse, and I actually joined the board of directors there. I was a board member for 10 years. And actually, thanks to that, I got my Refsum diagnosis relatively quickly, because through a chance discussion with the president of Retina Suisse, I mentioned to her that I had also lost my sense of smell. And she clicked immediately, and she said that she's aware of a syndrome that presents with both of these conditions, or both of these problems, excuse me, and that although it's a long shot, I should be tested for Refsum. So I went to the University of Zurich, and they did a phytanic acid blood test. And sure enough, my levels came back elevated. They were about 190 micromoles at the time. Because of the the extreme diagnosis, I wanted to have a second opinion about it. And I went to a university in Germany who had looked after a number of patients for their confirmation. They also did the blood test and various assessments, and they confirmed my Refsum diagnosis. The University of Zurich gave me the diet sheet that they were using at the time. And I went home with that. And because the diet sheet was so limited, it took me quite a while to actually come to terms with changing my diet. And probably shouldn't mention this because I don't recommend it to anybody, but it was at least a good year before I had the courage actually to go on to the Refselm diet. And in the meantime, I had made contact with the Refselm clinic in the UK, and they had provided me their diet sheet, which was quite different from the sheet that I had been given in Zurich. But because they had strong rationale for the premises of their diet, I decided then to start following the Refselm clinic diet, and since then I've been following that diet in a very compliant fashion. Thankfully, my Refselm journey has been, or let's say the progression of the disease has been relatively slow. My main problem is tunnel vision, so my vision has decreased to about 25 degrees. I was forced to give up driving in 2014. Thankfully, I live in Switzerland, which has an extremely good public transport network, and I don't really miss driving, apart from times when going to the garden center or doing a big grocery order would be convenient to be able to drive, but otherwise it's very convenient to get around by public transport. I do have some loss of hearing, although I don't use hearing aids, certain voices that give me issues. And I do have recurring signs of neuropathy. They come and go. I know that despite following the diet, for some reason I haven't been able to keep my levels under control. They fluctuate up and down, unfortunately on the high side. Although I do my best to make sure that when I exercise, I'm eating beforehand. And I do try to maintain a relatively stress-free life. Although in this day and age, I mean, stress is around us all the time. I work reduced hours now. 5 years ago, I reduced to working part-time. Work at an international pharmaceutical company as a global trial leader. And thankfully, my company is one of those companies very advanced with diversity and inclusion. And working part-time with a disability is very much welcome there. I think that's the end of my story, Susie. I'll hand over to you.
Thanks, Susan. It's good that you have a supportive workplace. I think that's one of the hardest things for people with disability. And I think probably all around the world there's very high unemployment for people with disability. So it's good to hear. In terms of my story, I'm probably textbook case of Refsum, which I know in hindsight. So my parents came to Australia from Hungary. My dad came after the war, and my mom when they got married in early 1970s. My parents were quite isolated, and my mom didn't know any English, and my dad did night shift. So probably the first symptom that would have been noticed was by the pediatrician was that I had my fourth toe on both feet were short. My dad decided that I should join the Girl Guides, and when we were walking there, that was when we discovered that I couldn't see in the dark. So I don't recall, but I don't think I ended up joining the Girl Guides. Anyway, and then at school there was like a lot of testing, and then they noticed there was something wrong with my eyes, and then I had to go see an ophthalmologist, and that was when I was diagnosed with retinitis pigmentosa. But back then I wasn't told what my condition was, and it was all very hushed voices between the doctor and my parents. And anyway, so I didn't know what was going on. But I did notice in primary school that my peripheral vision started to get worse. And by the time I was in high school, I lost my peripheral vision, although it still, wasn't fully, I still didn't fully twig. When I was about 14, they told me that I had retinitis pigmentosa. All I think I really understood was that I had to wear sunglasses and eat vitamin A. And my dad used to make me eat lots of carrot, which I hated. I don't think I fully appreciated it until I was playing squash, and I hit another girl in the head very hard with a squash racket, and she did not speak to me again after that, and I did not play squash again after that. But I think that was when it kind of really hit me, what about my vision. Anyway, when I was in high school, I had one cataract operation, and in my 20s, I had the second eye cataract operation. So by the time I went to, and I guess I should also say that doctors weren't particularly supportive, telling my parents that I was probably never going to work and I should learn how to type. In any event, I went to uni and managed okay. I was lucky that I still had my central vision, even though I didn't have peripheral or night vision. And I studied law and ended up becoming a lawyer, which I still am. So in my late 20s, I started noticing hearing loss, and I started going to a series of ENTs in my 20s, 30s, and early 40s, and nobody, I explained I should also mention that I never had any sense of smell from, I don't think I've ever had a sense of smell. That was also picked up in childhood. Anyway, so by the time I started seeing all of these ENTs, I, told them about my RP and my hearing getting worse and having a sense of smell, and none of them put, all of the dots together. None of them thought outside of the box as to whether there might be something going on other than hearing loss and maybe something weird with my sinuses as to why I can't smell. Anyway, so in my 30s, when I was a child, I really loved bike riding, and I wanted to return to that, but with RP, I could not ride a bike on my own, and I really got into tandem riding, which I did for about 10 years, including riding about 25 kilometers, and interestingly, I never had any symptoms at all, in retrospect. Anyway, when I was 40, I had my last ride. I rode with a person that I had not rode before with, and we didn't coordinate, and we fell, and I broke my ankle. I had to have surgery because I couldn't care for myself. I ended up getting Meals on Wheels, and that was when I had these weird symptoms in my feet, which I didn't know what they were. My feet were quite cold. And in retrospect, I now know that was peripheral neuropathy from phytanic acid levels being high. That went relatively quickly once I went back to my normal life. 3 years later, when I decided to become a bit fitter and got a personal trainer and started to lose weight, I had a rapid onset of all the neurological symptoms. I was having difficulty walking, having difficulty holding myself up, feeling dizzy, eventually lost complete sensation in my feet. My doctor could not work out what was wrong with me. I ended up seeing my neurologist, and she immediately worked out what it probably was. Refsum. Anyway, the next day I had a whole day of tests in hospital, and the day after that I was in RPA. I was there for a few weeks, and it was pretty awful and isolated. They did tests, and I was waiting for the blood test to come back, which took 3 weeks. And I later found out that the lab thought that there was something wrong, and because they'd never seen anyone with such high photonic acid levels before. Anyway, they eventually provided the test results. I went into rehab hospital and got released because I wasn't improving. It took me much longer than Mark to start to walk again. It took me about 18 months, and I had a very intensive plasmapheresis. So I went from a pickup frame to a rollator to walking stick. So that took me about 18 months, and at the same time I'm having plasmapheresis, and I won't go into all the details because of time, but there were like lots of hospitalizations in relation to my plasmapheresis. I ended up getting a fluke stroke after one operation, and I still have quite a lot of right-sided weakness, and when I walk lopsided. So that's something I'm still working on. The overall, I probably have pretty much all of the symptoms of Refsum. In that sense, I guess the classic textbook case in terms of hearing loss. I have hearing aids, RP, no sense of smell, weakness in my legs, poor balance. Sometimes I get itchy skin, and not everyone has it, but I also have a lot of abnormal bone structure as well, which is impacting upon me, and I'm waiting for a date for knee replacement surgery. But the way that I walk, I'm not very aligned. So I don't know if that will improve after I have the knee surgery. I guess the only thing I would say that so when I got diagnosed, it was quite lonely, and it was great to find the Yahoo group that Susan and Liz set up. And now that we have DARE, I think is such an important organization, not just in terms of helping provide a cure for the future, but also to help patients improve our lives in terms of better information about diet, better information about clinical care, but really importantly to connect patients. Because when you've got an ultra rare disease, that is an incredibly lonely thing. And yeah, so DARE plays such an important function. Just seeing how we're going. So we've only got like a half hour left, so we might try and get through some of the other questions relatively quickly. So what is the most frustrating thing about having Refselm? For me, it is being an ultra rare disease. There are just so many things that we don't know about it, and it makes it quite hard to manage the condition being a rare disease, and trying to reduce further deterioration. Did either of you want to add to that?
Yeah, I think the sensory loss doesn't help. It's all right if you've got poor sight, but when that actually affects your hearing and your sense of smell, it can get days when you begin to wonder, I can't hear, I can't see terribly well, and then something boils over on the stove and you think, should have smelt that, and it's only when you actually realise that it's boiled dry that you missed it. So yeah, it is a challenge, daily life.
Yeah,
I would agree. A lot of people have various medical diagnoses. There's people who have just hearing problem, or people who just have RP or just have ataxia. But with Refsum, we have it all. Some of us have it all, some of us have a combination thereof. We see a lot of variety amongst us. But when you are living with a condition that affects so many, sensory aspects, as well as mobility, it gets very challenging sometimes to deal with it all. Some days are better than others. But it's just, sometimes depending on how you wake up, you may wake up on the wrong side of the bed and everything hurts. And you think, how am I going to get through this day? And the other days where you wake up feeling fine and you think, I'm on top of the world. The other thing that I find a bit frustrating with Refsum is that it's a deteriorating condition, right? So we're always getting used to a new normal. And I often think with my vision, okay, I've lost so much. If it would only stay like this, I can cope. But, there's this nagging thought in the back of my head that says, well, maybe it's going to get worse. How are you going to cope then?
Yeah.
We don't, you just do your best to cope. But it's, so much going on at once that sometimes it's overwhelming.
Yeah. Yeah. I sometimes have one of those Duna days when everything hurts too much, and I just decide I'm just going to stay in bed for the day. So how do you find it hard to comply with the diet? What's the most challenging part? Mark, did you want to say something?
I think that having lived on the diet for so long and how it has evolved over the last 43 years, you suddenly realize how well off patients that are diagnosed with Refsums are now, because the early diet was pretty awful. Trust me, there was very few foods that we were allowed to eat, and you ate the same thing day in, day out, and you had a supplement to drink as well. So yes, I do as much as possible now comply with the diet. One of the questions you do ask yourself sometimes is, as we adapt the diet and things go on and off, you think, well, I've eaten that for 35 years, I'm still here, I don't really notice any deterioration. And then you find out that it was higher than first described, so you begin to wonder, should I stop it or should I just carry on with caution?
Yeah. For me, I guess one of the hardest parts is eating out, because the other day I was at my local cafe, and I asked them, I normally have something else, but I asked them whether their schnitzel was marinated in milk, and then they said yes. But I also found out that their grilled chicken, which I've had before, is also marinated in milk. So I guess that's kind of one of the things that you've always got to be on edge with this condition, I think, and just with disability in general. Like, you've always got to kind of think about, how was this made? Would it have something in it that might increase my vitanic acid levels? What about you, Susan?
Generally speaking, I don't find it difficult to comply with the diet. Like I said before, it took me a while to get the nerve up to go on the diet. But like many things that I do in life, when I commit to something, I'm sort of there for the long term. So I am committed to the diet, especially knowing that it'll have a direct impact on my health. Having said that, there are certain things that I miss. I'm living in Switzerland, this is the land of milk and cheese. That's, one of the things that I really miss. Thankfully, there's, good alternatives coming up that are now available on the market, but, nothing tastes the same as a true, sticky, gooey mozzarella cheese on a pizza. Let's face it, no alternative will be that good. But, you know that this is, you're doing this for your health, and so you just accept the limitations in the diet and make the best of it. I do agree with you, Susie, that eating out is a challenge. Before the pandemic, I was in the office all the time, and I was eating out for lunch. I mean, my tactic is to speak to restaurateurs beforehand and, tell them that I do have limitations and, ask them how they make things, because like you said, something may be marinated in milk, or they may be mashed potatoes and it may be without butter, or it could be with butter. So it's always important to understand, how they prepare things. And, if you have the opportunity to speak to a restaurant in advance, it's just less stressful when you're actually there. But of course, things are always changing with the way things are cooked. It's like ingredients on a food item. You may have gotten used to eating a certain food item and you don't check the label anymore. And then all of a sudden you look at it again and you realize that the ingredients have changed and there's something in there that you shouldn't be eating. So you always have to stay vigilant.
Yeah. I guess maybe the saving grace is that probably like a one-off is only going to have a minimal effect.
Yeah, that's true.
Do you identify as a person with a disability? Did you want to say something first, Mark?
Definitely. Being, I guess, deafblind and poor mobility, you can find yourself isolated at times, and people still have a habit of, because you can't see, they will speak to the person with you. I find that equally frustrating because, as I say, speak to me. I can hear you and I can just about see you. So please address me, not my friends or my partners.
Yeah. What about you, Susan?
For the longest time, I didn't identify as a person with a disability. My symptoms are not obvious when somebody meets me initially. And, I felt that I was functioning fairly normal in life. It's only since my vision has deteriorated to the point that, depending on the circumstances, excuse me, I need to use a white cane. I have a signal cane that I will pull out just to make sure that people around me are aware that I am visually impaired. It's for my own safety. So, using a cane obviously, is some identification that you are disabled. But for the most part, I still get through life with concealing my disability. And I think that's one of the challenges with coming to terms with a disability is being able to own it. And speak to other people about it, make them aware. Having a disability makes you very vulnerable. Using a white cane, even if it's a signal cane and not a long cane, I do feel very vulnerable. I feel it's almost like coming out of the closet. People say, "Oh, Susan, I didn't realize," and because I use a cane more often, I am now telling people in advance, I do have this disability. And of course, doing all this awareness work through the DARE Foundation, of course, I identify as a person having Refsum, and I'm more comfortable about, owning it and raising awareness about it.
Yeah. Well, I definitely identify as a person with a disability, and it's pretty obvious since I use a walking stick. Often when I have to go somewhere new, I have to work out, if it's accessible or not. Because at the moment, I don't have enough strength in my legs or enough balance to go up and down stairs, and have to find and don't have the speed to get on escalators. So I have to find lifts. But I think it's a different conversation for a different time. But I think it's important to identify as someone with a disability because it's only when you're seen that people become more aware of disability, and that disability is a part of life, and people need to think about being more inclusive. Sorry, did you want to say something, Mark?
Yeah, you're absolutely right, because you almost feel a second-class citizen, as if people will ignore you. And that is frustrating. A typical example is perhaps when I used to go to the shops and you were stood in a queue, and because people assumed you couldn't see, they used to push in front of you. I found that most frustrating, or being ignored because you're just standing patiently waiting, and that is most irritating. Or
Yeah.
one other one was, you're in the supermarket and you ask where something is, and somebody waves a hand and says, "Over there." Well, that means nothing to us. You need to educate people, and all I ask is we're treated with respect and dignity.
Yeah. Yeah.
Yeah.
Um,
Okay. I think that's changing though. Of course, there's a lot of cultural differences, and we see it, within our group where we come from different parts of the world. There's different levels of acceptance towards people with disabilities around the world. When I go back to Canada, I see that things are a lot more accessible, and people with disabilities are being, more and more integrated into the normal way of life. Whereas in Europe, and especially Switzerland, the same level of acceptance is not yet there. There's still work to be done.
yeah.
Yeah.
So Susan, you've already mentioned that you've gone from full-time work to part-time work. Mark, did you end up having to stop work earlier because of your reason?
I was stopped doing, well, it was unsafe to do my clinical job. So the last 10 years, I actually spent behind a desk being a manager and using the brain rather than my physical body. And I was also allowed to work at home. And bear in mind, this was long before the pandemic. So
Yeah.
I could do all of my computer work from home. I could answer the phone from home. And I often had a couple of days a week where I didn't actually have to go to the office, and nobody really noticed the difference. So I was lucky. I decided to retire at 60 because I could, because I had a private pension. And you get to the point in life where you need to enjoy life, because you just never know. And with Refsum, you think, yeah, enjoy it while I can.
Yeah.
Mhm.
That's good. Um, do you find that either your disabilities or Refsum stops you from doing social, personal things or participating in family events? So I might start. It definitely stops me from doing certain things, and I don't explain it to people, which probably I should. So, like even before COVID, I wouldn't go to. I would rarely go to work drinks, for example, because often I find pubs and clubs to be quite hard to negotiate, having night blindness, and also because of my hearing. So even if even if it's step free, I generally avoid it because it's very dark, and also with hearing aids, it just amplifies the noise, and you can't hear what people are saying, and it just becomes quite exhausting. So that's probably the main. Like, so there's certain types of social activities that I do avoid. Do either of you want to comment?
Yeah,
Go on,
sorry,
Susan.
go ahead. Okay, ladies first. I wanted to say that I try not to not participate if possible, because I do want to remain active and involved as long as possible. But what I do find challenging is doing things in larger groups. If possible, I would rather do something, just with a single individual. And I know that I can rely on them, for out in the evening and I need to hold on to an arm or need assistance to come home. When it's in a larger group, it's a lot more challenging. And I do find that I tend to avoid those kind of activities.
Yeah. What about you, Matt?
I no longer venture out on my own. I always have somebody with me now, because when I used to go out on my own, one of the last times I actually got mugged by someone. I felt it's a most unnerving experience. And so, right, you become vulnerable and you feel vulnerable. So I now go out with someone at all times. And if I want to do something, somebody will usually take me. Yes, I miss dancing because I can no longer dance. I wasn't very good anyway, but I can't dance. I can't participate in sport anymore. But socially, I do have a limited circle where I do actually venture out and enjoy life.
Okay. What would you like health practitioners to know about living with Refselm? In particular, what would you like them to be aware of? Susan, did you want to start?
Yeah. Go on, Susan.
Yeah. I think what's important for a practitioner to know is, like I sort of alluded to before, that living with Refselm is very challenging, just because there's so many health disciplines involved with the condition. And when you go to see one specialist, then they're really only concerned about their area. And I understand that, that's their specialty. A neurologist will be looking at the neurological aspects, and ENT will be looking at ENT. But it would be nice if they sort of considered us as, from a holistic point of view, because it's the sum of all of the difficulties that we have that really make the condition challenging. And it seems that there's just not enough empathy for that, really, or not enough willingness to see that aspect. And the other thing that I sometimes do find annoying, I go to see my caregivers, and they know I'm connected with the DARE Foundation. They know I'm connected, with the Medical and Scientific Advisory Board. And they always say to me, well, you know more than we do, and it's great. They're willing to learn from me. But I sometimes find that they're not willing to go the extra mile to, look at my case and figure out, well, what can we be doing differently? Like, for instance, my photonic acid levels are very high despite the diet, Why is that happening? Nobody has an explanation. Now I've encouraged them to reach out to the Refsum clinic in the UK and, get expert advice there, and hopefully that'll, bring something. So I guess the point I'm making is they need to, really make the extra effort and go the extra mile when managing a patient with Refsum.
Yeah. Mark, did you want to say something? And now might be a good opportunity for you to talk about your difficulties getting your photonic acid levels measured.
One of the problems in the UK, and it's not just the UK, it's probably around the world, is getting access to a reliable, speedy service when we need to do a photonic acid level assay. Because at the end of the day, we live on a diet. We need to monitor our levels fairly regularly to ensure that A, we have compliance and our levels are ticking along at a sensible level. At the present moment in time, regionally, it is difficult to get a blood test outside London. And when you do get one, the result can take months. That is not acceptable. And I guess one of our DARE missions is to ensure that all our patients get access to reasonable times for blood tests and get a speedy result. And that's most important if you're actually ill and you know your levels are high, that you need to monitor them a little more closely. But unfortunately, the way that the system is set up at the moment, it's, well, we'll just do the blood test, we'll wait till we've got a few and then batch test them. That's completely driven by finance and not in the patient's interests.
Yeah. Yeah. I guess my comments are kind of more general, but along the same lines that that I think doctors, health practitioners need to be more patient-centric and look at things from our point of view rather than what is most efficient for them. And, I think, probably if they did that, people like me who clearly had all the, sign, at least quite key symptoms from very young age, RP, fourth short toe, no sense of smell. But even, seeing an ENT in my 20s, because I was starting to lose my hearing, they should, think out of the box, be curious, and, kind of think, well, it's a bit odd that this person has all this sensory loss. Maybe it's not a coincidence. Maybe there is a genetic condition. And in retrospect, that shouldn't be that hard. And, obviously, had I known more, I could have pushed, but obviously I didn't know. And most patients don't know. It's only once you become very involved in the system that you learn how it works, and you learn how to ask questions, and you learn how to say no. But it takes quite a long time to get to that point.
Yeah, but you also have to remember that we have amassed quite an amount of information on Refsum disease. We've got a lot of research in the current bit, which, yes, we do the research, but in isolation, what does it actually mean to the patient? What do we feel? What do we see? What don't we see? How hard does it impact on our lives? And this is sometimes a bit that's missing, because clinicians can be very good at the diagnosis, but you're right, they don't show much empathy, and they don't always communicate with each other to ensure that we get the best care.
Yeah, that's true. And I don't know, Susie, where you're seeing in Australia, but here in Basel, I'm at the teaching hospital. So unfortunately, what happens is, you're seeing a resident, and you may see them for a year, and then, of course, the next time you go, there's a new resident, just because it is a teaching hospital, and that's the nature of it. And I find that extremely frustrating, when you have an ultra-rare disease and you're, dealing with these residents who don't have too much experience so far, and it's like telling your story from the beginning again.
Yeah, that's the same when because I have to go to the neuromuscular clinic at the hospital, and the same thing happens. And they are often more, I guess, concerned about their own learning, rather than working out, what's going on with me. I mean, I still have my neurologist as well, but yeah, I think, it's sort of a different issue. But you mentioned, Mark, that when you were diagnosed, you were paraded up and down the country. And I remember when I was diagnosed with RP, and I think it really added to my, as a child, it really added to my, trauma, where everyone wants to look at you like you're this novelty. And it's just something I really hate. And, now if they ask to do that, I just say no. Like, I don't really care if they want to learn. Like, for me, it's just upsetting.
Bear in mind that I was a nurse for 42 years, so I'm used to the system. Yeah. And anything that I could do to enhance the disease, and for 10 years of my life, I used to be a patient for the doctor's practical examinations, and you'd get junior doctors examine you and coming up with a whole list of bizarre syndromes. But one thing they did learn, once you've seen a Refsum patient, you never forgot it. So I actually believe the more that people can look at the symptoms instead of reading it in a textbook, you actually understand, and hopefully we can continue to spread the word.
That's true, but it'd be good if they could find a more sensitive way to do it, rather than treat you like a case study.
It can be done sensitively.
Rather than a case study.
Yeah, but it should be done sensitively. That's how you get patients to participate. And yes, some people feel very conscious of it, and I can completely sympathize and understand. And as long as it's done in a sympathetic and learning manner, then that's absolutely fine. But I have seen some that have treated us just like pieces of meat, and I find that degrading and tell them so.
Yeah. So I guess the last question, what would improve your quality of life? Which I guess it's a broad question, so I guess you can answer it as you want to in terms of little things that might improve your quality of life, or big things on a wish list that may never happen. Susie, you want to go first?
Yeah, that is a big question. I mean, when I think about improving quality of life, my main wish would be, to have a cure for Refsum. And I do believe that we will eventually have a cure. It may not be, in my lifetime, or I may not be able to benefit from it, but it would be good if, this disease could be eradicated. I have to say, though, that I'm thankful that, having to have such a disease like Refsum, that I have it now, and not, in the early days when technology didn't make things as accessible as it does now. I'm thankful for all the technological advancements that have occurred, and I'm, eternally thankful for the work that's being done now about, for Refsums, for the research that is moving along with the support of DARE. I think these are exciting times. But yeah, my one wish would be, to be healthy again.
What about you, Mark?
Yeah, I guess a cure for Refsums would be nice, but being realistic, it's not going to happen in my lifetime. And I'd like to think that as a group, what we do now will pave the way for subsequent patients who hopefully will be diagnosed much sooner, and they will not have some of the symptoms that we currently have, and they will get themselves on a diet to wait for the day when eventually we will cure or eradicate Refsum disease.
Yeah.
Yeah, and Mark, I think we're seeing that already now with the genetic testing that's now being done. If somebody presents with a symptom with RP, very often then they'll do genetic testing. They'll want to know the gene that's responsible for RP, so that they can, the patient can be put into a registry, and the data is available. There is potentially a gene therapy for RP. So through this, then they're finding out more cases of Refsum at an earlier age, which has a huge benefit then for the individual to be able to go on the diet early. And I mean, we don't know yet. We're still learning. What does it mean for somebody to go on the diet at an early age?
Yeah.
Is the majority of the symptoms be prevented, or will they still continue to deteriorate? We're still learning, but we're making progress.
If I consider my brother was 16 when I was diagnosed with Refsum, he also has it. He's had a head start. He's got a much better chance in life than I have, and doesn't have the number of disabilities that I have. So yes, early diagnosis. And the simple bit is, any patient that is diagnosed with RP, take their shoes and socks off and look at their feet, look at their hands. It's not complicated. But, ophthalmologists don't like looking at feet. It's not in their repertoire, really. And I think that's the message we have to get out there. RP, look at their hands, look at their feet. Then you can do the blood test and confirm what you're seeing.
Yeah, definitely.
Yeah. I have a more practical, I guess, hope for my quality of life. So when I got diagnosed with Refsum, I lost a lot of fitness. Not that I was that fit, but I lost a lot of fitness. So, and because I'm in hospital so much, or have been, my pulse and my heart rate is, measured quite a lot. So I know it's quite high. So my resting heart rate is often in the 90s, and low hundreds, which I know is incredibly high, and possibly a measure of how unfit I am. So I guess one of the things I would personally like is to try and improve my level of fitness by maybe using my exercise bike without fat burning. And I'm not quite sure how to do that because when I do go on my exercise bike just for 5 minutes, my heart rate goes right up. So it's just something I'm doing slowly because I think my quality of life and maybe my fatigue and other things would improve if I could get my level of fitness up a little bit, and obviously it would prevent other health problems down the track as well.
Yeah. Well, I hope that you get your knee surgery done soon because this will definitely bring you improvement in your quality of life with walking and reduce your pain.
Yeah. All right. Well, thank you to you both. I don't see any questions, but probably given the time it is in many countries, people are still in bed, I imagine. But thank you, and we've surprisingly got through pretty much all of it in less than an hour.
I think it would be good to thank all the people that hopefully have listened to this and may get some benefit out of what we've explained.
Yeah. I mean, I can't tell if there's anyone there, but if there is, I think it'll be on a video so people can watch it later. And
I think we'll probably get more video watches afterwards than we will currently.
I haven't watched the one that you were on with Alan and Christy because I didn't want it to influence this one because I just wanted to keep it fresh. But I will watch the one I did earlier.
I think the sound bite has to be, and we joked about this because Alan says, condemned to a life of this and living on chicken. I said, don't tell Susan that, whatever you do, because we're trying to get more foods out there. He said, well, it's chicken, chicken, and chicken. I said, yeah, you're absolutely right.
Yeah, now that pork has gone into the...
but that was funny.
Yeah.
Okay, well, thanks, Lucy, for hosting us.
Yeah.
And thanks, everybody, for listening to us.
Yeah, thank you.
Thank you.
Thank you.